My name is Alvin Doe. I'm a Liberian. I am currently the only neurosurgeon residing in country. The needs of neurosurgery in Liberia is huge, very, very huge. At times when you see some patients, you believe that there are things to be done, but unfortunately you do not have that means to help them to improve their condition. It's something very, very challenging, but I think it is something that with God, I was made to do. Every morning, whenever I leave my home, I say, Lord, help me to be able to do those things that you made me to do.
It's really tough to build neurosurgery in any kind of part of the world.
So neurosurgery, it requires a certain level of infrastructural commitment to be able to render that service safely. Liberia's infrastructure is still developing.
Korle-Bu Neuroscience Foundation have taken on the task of bringing neurosurgery to Western Africa.
To practice good neurosurgery, you need a CT scan, you need an MRI. Now, if you build a center that has an MRI and a CT scan, the effect is not only for neurosurgery. You are taking care of the whole health system in that aspect.
The crux of the issue is how do you build high quality neuroscience care in West Africa?
KBNF consists out of 3 pillars. The first pillar is the shipment of medical supplies and equipment.
We have hospitals that are not fortunate to have supplies reach them all the time. So they have cases and they cannot attend to the patients, so they have to refer them to other hospitals. So we are able to reach out to these hospitals and give them the equipment they need. We have IV tubings, we have needles, we have syringes, we have cartons. We are visiting neighboring towns and cities within Liberia. So when we come in and supply the people, they are happy. And we are helping doctors and nurses save life. It makes me particularly happy that I can help the community.
The second pillar is education and training.
Training of the staff is very, very paramount.
Every time we're here, we're teaching in a mentorship style, as well as this year we had a 2-day critical care training. Nurses from different hospitals all over Liberia was invited to come partake and learn how to do neuroassessment. This will increase the type of care, the quality of care.
Because neurosurgery is not just operating, okay? You need a well-functioning intensive care unit. You need an intensivist to help you to take care of your patient.
We partner with nurses, OR teams, to make sure that the team is robust enough that the quality of care we can give is of the highest standard. The third pillar of KBNF is neurosurgery.
Neurosurgery is that specialty of medicine that deals with the brain and the spinal cord.
The scenarios before and after for patients can be quite dramatic. You have patients who are paralyzed, Some patients have tumors and they're may not be able to walk, maybe wheelchair bound, and you see them come back and they're walking.
We are humans and our basic existence is to serve each other. If it is just providing for ourselves, our needs are so small. But you see, it is not everybody who can provide for themselves all the time. That is what makes us human. And so if I have a capacity to provide something, in my case, a surgical service, and I do not, that in itself makes my life unfulfilled. So I wake up every morning and I know that I'm going to be of help to someone.
What we're trying to do is demonstrate the value of heart power, caring with your heart, caring with compassion, regardless of the situation. It's critical in the healthcare industry, it's critical in life. But if we could start it in a hospital center, it can work out.
Do what I do so I can help people. And in an environment like ours where that help can be few and far in between, it can be and it basically is life transforming.
We're building a family, we're building an international family, one that can support one another. And we're partnering with champions. There's many champions in West Africa that are doing incredible things with very little resources.
Little drops of water makes a mighty ocean, as the saying goes. All right? So if everybody else would do that small bit, the world would be a better place to live in.